everyone for joining us. And here is Melissa with AquaCare.
Hi, everyone. My name is Melissa Martinelli. I'm an occupational therapist and lymphedema therapist at AquaCare Physical Therapy in Lewis, Delaware. I want to thank everyone for joining me today, and thank you to Kate from the Cancer Support Community Delaware for having me on for the second part of Healing After Breast Cancer. Today, we're actually going to be discussing something related to Lymphedema Awareness Month. March is Lymphedema Awareness Month, and we're going to be talking about how to reduce your risk for lymphedema after being diagnosed with breast cancer and undergoing breast cancer treatment. And I'll be teaching you today some things to do for lymphedema risk reduction and how to do self-management techniques. So I'm going to share my screen. Just give me a second here. And let me start my slideshow. Okay. All right. So going first to meet our team. This is our team at AquaCare Physical Therapy in Lewis, Delaware. We have 3 women here to service your needs when it comes to oncology, rehabilitation, and lymphedema management. So first we have Jillian. She's an occupational therapist like myself, as well as a certified lymphedema therapist. And then Lane is a physical therapist and a women's clinical specialist, as well as a lymphedema therapist. And that's me on the end. So we're happy to be part of your team locally if you have any concerns when it comes to lymphedema and how to manage it. So our objectives today, we're going to go over and review the functions of the lymphatic system, and then we'll define what lymphedema is and breast cancer-related lymphedema and the associated risk factors of that. We'll want to identify the causes, some symptoms, and then the stages of breast cancer-related lymphedema, and then discuss what we do actually to treat breast cancer-related lymphedema. So we'll learn about the benefits of therapy and strength training in order to reduce your risk. And then at the end, we're going to receive some instruction on how to inspect your body and then also how to perform some manual lymphatic drainage. So the lymphatic system, what is it? So looking at this network of vessels and nodes that actually are comprised also of organs, and they transport lymph fluid. So what's this fluid that's traveling all throughout these vessels? It's comprised of water, proteins, lipids, glucose, ions, and all different cells. And what is it responsible for doing? So it helps to regulate the fluid balance in our bodies, and it filters cellular waste. It aids in the immune system response and helps protect our body against certain foreign objects that cause infection or cancer. It also assists in fat absorption. So what does this really mean? I like to think of the lymphatic system as the system that's like the dump truck of the body. So it helps to recognize if there's foreign objects or if there's waste from cells that our body naturally produces. And it helps to remove this fluid and circulate this fluid throughout the body so it can be removed as waste. And that'll make a little bit more sense when we talk about lymphedema. So what is lymphedema? It's an abnormal accumulation of this protein-rich lymph fluid in an area of the body. So it occurs when there's an area that's built up where there's lymph fluid that happens to block or be blocked or damaged, where there's a damage or block in the lymphatic system. So in situations for breast cancer lymphedema, related lymphedema, you may have, we'll talk about lymph nodes being removed or surgery, trauma, radiation that could impact this ability of the lymph of the arm to flow or from the breast to flow. And that blockage is essentially what causes backflow and refill in certain areas that causes congestion. So there's different types of lymphedema. You have primary lymphedema, and this is an abnormality of the lymphatic system that you're born with. So whether that's an over-proliferation of lymphatic vessels or underdeveloped vessels, this is something that can persist at birth, but might not present until later on in like middle age or in teenage years. It just really depends on your condition. As far as secondary lymphedema, this usually occurs as a result of cancer treatments, surgery, infections, trauma, injuries, or even obesity. When you have excess fat tissue, it's harder for lymph to flow. So that also can be a risk factor as well for secondary lymphedema. So breast cancer lymphedema is actually lymphedema that occurs in the breast, in the arm, or the surrounding region. So when you're looking at the pictures here on the side, this is the area of the breast and axillary lymph node region that actually can be affected in situations related to breast cancer treatment. So it really depends on the type of treatment you receive and how much risk you're at based on your treatments themselves. So, in a situation where you've had breast cancer and you're undergoing a sentinel lymph node biopsy, this is where a couple of lymph nodes are removed, typically from 1 to 3 lymph nodes. There have been rare cases where you'll see up to 4 or 5, but typically, as you get past 3, then it would be considered an axillary lymph node dissection. So, you have about 35 to 45 lymph nodes in your armpit bed. So if you start taking away pieces of those vessels, you can consider the fact of vessels being backflow. Think of your body as like a house. So when there's pipes in the house that carry fluid, if you start taking some of those pipes out, then there's going to be backflow somewhere. So the more pipes that are taken out, or in this case, the more lymph nodes or vessels that are disrupted, then you're at higher risk for lymphedema. So the other thing, aside from the lymph nodes being removed in surgery, you have other treatments for breast cancer that can really impact that flow. So any sort of impacting the flow could be causing fibrosis, or if that's like a hardening or scarring down of some of those lymph vessels. So you might experience that after radiation therapy, after chemotherapy, or even if you've had an infection or complications from your surgery. I really like to make note too that your body has this natural ability and memory to really hone in on the things that have happened to you aside from breast cancer. So if you've had other, like say, heart surgeries or areas, maybe a shoulder surgery or areas where you might have had scarring, this can also compound, that backflow. Scar tissue, what you see on the outside, isn't necessarily the length of the scar tissue that is on the inside of our bodies. Your body remembers that. And then as a result, if you have additional lymph nodes taken and there's area of scar tissue from other injuries or surgeries, this can then increase your risk even more so. So the incidence and statistics on breast cancer related lymphedema, there's studies that suggest approximately 20 to 42% of our individuals that have breast cancer and undergo axillary, meaning under the arm removal of lymph nodes, will experience lymphedema at some point within their lifetime. So you're never really without risk over time. So you can see in the graph here that by 2 years, you're seeing that elevation for someone who's had a lymph node dissection is at about 20%. If you couple on having radiation as part of your treatment, that risk goes up slightly. And then over time, as our bodies age, as different things happen to our body, the lymph and the transport of that ability becomes less efficient. So then that increases also the risk over time of getting lymphedema. So knowing what the risk factors are and knowing, what type of procedure you had and what other things could also be affecting you is how to really delineate how much risk am I at, and is there a possibility that I'm going to get lymphedema at some point in my lifetime. What's not on here is our individuals that have had sentinel lymph node biopsy. So there's usually about a 5 to 8% chance over time of someone undergoing sentinel lymph node biopsy, but then couple on having radiation that then increases the risk over time. So other risk factors that you might see also would be other traumas or infection, obesity, immobility. So if you're unable, let's say you, after experiencing your breast cancer and all your treatment, then you have additional surgery to the arm, or you're immobile in the arm, that places you at higher risk. And over time, as we age, like I said, the lymph transport capacity tends to slow slightly, and we're less mobile than we are traditionally in our younger ages. Okay, so the stages of lymphedema. So stage 0 is considered the latent stage, and that's right here. So you might not see any visible swelling or comparison of either side of the arm. So you might, though, experience these sensations or the feelings that there's swelling in there, maybe a heaviness or a tightness or aching, as a lot of the times when my patients don't have visible swelling, or when I measure their arms and they're not any different in size, but they're just consistently saying that they have these physical symptoms. And that's a realistic thing. So we do have interventions that we treat for that we'll talk a little bit more later in the presentation. As far as stage 1, you'll see maybe a slightly difference visible in swelling, like when you're looking at yourself in the mirror, if you're comparing, we'll go over this too, when you're comparing different sides from one arm to the next. And I'll teach you how to look for those areas. But this is also a swelling that might resolve spontaneously, or if you elevate your arm, or overnight when experiencing rest overnight. So you might notice also some soft pitting, which is when you actually push on your skin and it leaves an impression for a period of a couple seconds. And if that happens, that could be a subtle sign of swelling. Usually that you might be checking in those areas of the hand or the forearm. Stage 2 is where you actually have more persistent swelling that doesn't reverse, and it actually doesn't reduce overnight. And in this case, that pitting that may have been soft as in the previous stage might be a little bit more firm or thick when you go to touch the skin. In stage 3, you have significant swelling and hardening of those vessels. So at that point, your skin might be tight, it might be very firm, you might not have any pitting, and it might be very full, and you might lose different aspects of your contours of the arm at any point through the arm, the forearm, or the hand. So what are the signs and symptoms? Heaviness, achiness, fullness, tenderness. Sometimes people say it feels kind of like pins and needles, not to be confused with post-surgical, interruption of some of that nervous system tissue, but itchiness, discomfort, or even just an odd sensation. But the other obvious thing too is the visible changes in the shape of the arm, the trunk, or even the breast. So being mindful of the fact that you might not just experience it in the breast area, it might be in the arm, it might be across the back, underneath the armpit. So it doesn't have to be isolated to the arm or the hand. What lymphedema is not, it's not traditionally painful or characteristically painful. A painful swelling could be an indication that something medically complex could be happening. So that could be something like an infection. So redness that looks more of like a mapping appearance, or a redness that is climbing up the arm or the chest or the breast. That's usually tender to the touch, even more so. So it shouldn't be painful. It also could be an indication of clotting, or unfortunately, it could also be an indication of malignancy or a sign of additional cancer present in that region. So for visuals, I know we talked a little bit about this, but then it's important, I think, to see what I'm actually talking about when I say pitting edema. So this is where the imprint is left in the skin for a short period of time when pressure is applied. So that is just something where you might hold or test in an area for maybe like 2 to 3 seconds. If it leaves an imprint or indentation like you see in these pictures, then that could be an indication for lymphedema. You might also notice indentations from like your sheets when you wake up in the morning, or in your clothing, or if your jewelry is a little bit too snug. If something's very, very tight, it would also leave an impression in my like arm or hand. But if you notice that there's a change in like your rings where they just feel tighter, this could be indications also of the beginning stages of lymphedema. When you're going to do your limb inspection and look in the mirror or after you get out of the shower, you might notice a visible change in the limb shape or size, or it might just look like it's full or swollen. You might also lose some of the creasing in certain areas of the arm. The other part of skin thickening is a condition that's called peau d'orange, and it's like an orange peel appearance. So when you look here, it's actually when fluid fills up around the pore and causes this pore distension. I tend to clinically see this a lot more in my patients that have breast-related lymphedema. So you'll see different dots along the edges of the breast in different areas that are more swollen. So it's important, I think, for everyone to see this and know, okay, this isn't something that's normal. This is something that would need to be treated. You're at risk for infection if you start seeing some of these characteristics of swelling. So you might be asking yourself at this point, or saying, I have some symptoms, or I think I'm at risk based on what I'm hearing. And I'm not sure if the symptoms that I have are actually lymphedema. So what should we do next? So what I would say is definitely talk to your medical team, because they can determine whether or not you have other needs for additional testing. So if you're having additional swelling and it's kind of coming out of the blue, you want to make sure that they're doing either an ultrasound, or maybe they'll do CT imaging or different things. If everything is clear from that point and they know that your risk factors are lending itself to lymphedema, then you can ask for a prescription for therapy. And I really would emphasize that you want to see a certified lymphedema therapist. And that could be for absolutely anything. It could be because you have existing swelling, so you're going for lymphedema management specifically. maybe you just know you're at risk and you want to establish like what your baseline measurements are. So if you were coming into our clinic, we would actually take measurements of all the different parts of your arm, your chest, your waist. So this way it starts as your tracking period. And we would keep those records so that way, if anything were to change over time, any time is a good time to come and get measured and get your baseline measurements. The other thing you might want to come for if you know that you're at a high risk factor, and a lot of our surgeons regionally are actually referring before radiation. Ideally, it would be nice if they could even refer post-surgically, or I'm sorry, pre-surgically for our patients that are at higher risk, just for education. Similar to what we're doing today, really talking about the risk factors, what you can do, how do you self-monitor, and then hopefully someday that'll become the standard of care. What I'd really like to emphasize is please don't try to treat yourself. There's so many different things available online. Everybody likes to purchase things on Amazon. I've had many patients that say, well, I bought a sleeve, but then I noticed my hand was getting worse, it was getting more swollen. These types of things, when we talk about compression garments for treatment, and we'll get into that next, is really important that it's well fitting. So if you're trying to put something on and if you don't know whether or not that's properly fit for you, you really want to see a specialist that's trained in this area. So please don't try and treat yourself. There's a lot of good information online, but even some of the information online, I tend to pick and choose when I'm, telling my patients what videos to use for manual lymphatic drainage, as opposed to just doing the search and picking the first thing that comes up. The other thing I would emphasize is please don't exercise aggressively. Exercising is wonderful, and we're going to talk about how to exercise, but doing exercise in excess, a lot of my patients will say, well, it's just getting fat, and it actually is not fat. This is lymph fluid that's accumulating and creating a backflow into like your arm, your chest, your breast, that region. So if you exercise, you're actually exercising aggressively, you're overtaxing the lymphatic system, and it can actually make your symptoms worse. And then the other thing I would say is please don't ignore your symptoms. At any point in your survivorship is a good time to really check in with your lymphedema specialist and talk to your doctor. So if you have something that's changed or something that just seems abnormal to you, it never hurts. There's not a bad question. Just please talk to your medical providers and they can guide you in the right direction. So let's say you have some symptoms, and what can you expect when you start therapy? Depending on the severity of your symptoms, we actually do what's called complete decongestive therapy. So someone that has like more moderate to severe swelling, we would want to take them through a compression bandaging program. This is this first picture here. So we would start at this phase where we're trying to reduce the limb, but many of our patients are coming at a time where this isn't even necessary. So I do a lot of modified decongestive therapy programs where we might just start with something as simple as you're not seeing a whole lot of swelling, but you have symptoms, and we might just trial using a sleeve. So the other components to this is actually the 4 pillars of care, right? So you can wear compression, whether that's for the arm or for your chest using something like a medical grade compression bra here. But then we also really emphasize the importance of skin care, nail care, how to cleanse your skin, how to moisturize your skin. You also would come in and you would receive manual lymphatic drainage. That's a skin stretching technique that we use to actually mobilize fluid and increase the transport of fluid into areas that are not congested. So that the therapist at our clinic actually does this technique and helps to mobilize lymph fluid. And then the key to this is that works in the moment, but then wearing your compression and as well as doing exercise and completing proper skincare are really all 4 factors come together in order to self-manage your condition. Other interventions that you might experience coming into the clinic is we would train you on how to do diaphragmatic breathing or breathing from your diaphragm. That helps to stimulate a lot of your central lymphatic nodes, so it helps to mobilize fluid as well. There's different techniques like kinesiotaping or use of Velcro compression for patients that might not necessarily want to go through a bandaging program. And then looking at the device here, I think it's important for our patients to know is as you progress with your condition, we'll start ordering different interventions that maybe you can have manual lymphatic drainage each day if your insurance covers this type of device. So coming in a couple times a week, To have your therapist do manual lymphatic drainage doesn't really yield the best results as if you're doing it to yourself. The best tool in all cases is your hands. So if you can come in, we can teach you how to do manual lymphatic drainage on yourself, and that can be used as a tool that you can do every single day, which is ideal. Other things that we do in the clinic, let's say you've gone through a decongestive program and then now you're at your smallest and everything is looking healthy. And now we need to order specialized garments. So we actually do custom measuring in our clinic. And it's really important to emphasize the proper fit. So some of our patients have normal limb contours, meaning their arm is a standardized shape or length. But a lot of times we're built in all different ways and all different body shapes and sizes. So we have to sometimes custom order, say if someone's arm length is too short, or if they have a little bit more fat tissue up at the top of their arm, or they have really sensitive skin. There's fabrics and different companies that actually custom make garments. And our therapist in our clinic actually can help size and do the measuring for you and utilize another durable medical equipment company, place that order and ship them to your home. But we ask that once these items are made, that you bring them in for fitting and training. So the fitting and training piece is very important because you're going to get education on how often do you have to wear your garments? What are your precautions with your garments? How do I wash my garments? And then how do I put them on and off? Because some of them are very snug. There's tons of different things out there to help you, and your occupational or physical therapists are well trained in teaching you how to put things on safely. So how can you reduce your risk for lymphedema? The National Lymphedema Network puts out guidelines. This is a great website and tool. So if you're uncertain about your risk factors and you want a little bit more information, this is a great website to go to. And the general guidelines in their position paper say just maintain a healthy lifestyle. So there's no real true lymphedema diet that you should have. We all should really be on a heart healthy, low sodium type of diet, but just making sure that everything is within moderation. Ideally, if you're at a higher BMI or body mass index at the time of your breast cancer diagnosis, you really want to focus on lowering your body mass index or losing weight or staying the same. It's the individuals after their axillary, like lymph node dissection or surgery, radiation, whatever treatments they're having, that gain weight
Right.
increasingly over time. It's more concerning and it elevates your risk factors. So diet is important, but exercise as well. So, and I say exercise, but it's also more or less just movement, general movement of the body, and increasing your number of steps per day really can make a difference in reducing your risk for lymphedema. And then when we talk about strength training, the importance is also starting low and progressing very slowly. So that way you're monitoring how your body is responding to exercise. You want to make sure that you're taking rest breaks during activity or and after for your recovery. And then the other thing that you would really want to do is taking care of your skin. And what does that mean? Keeping the skin closed, keeping it hydrated. So avoiding any needle sticks, cuts, scratches, bug bites, sunburns, anything that can open up the skin. If you have pets, these are the examples. If you have like a cat that tends to like be playful and scratches, you want to really make sure that if you get a cut, that you're washing with soap and water and you're applying any sort of antibiotic like cream and monitoring it. So signs and symptoms of infection could mean redness, rash, pain, fever, or flu-like symptoms. And you really want to make sure you're watching your skin so that way you're not experiencing increased swelling. It's important to get regular medical checkups and avoid any possible triggers. So any additional injury or trauma to that same region could elicit this lymphatic response that causes swelling in the area when you may never have an issue in the past. I had a patient who was playing with her grandson and they were wrestling and he came down very hard on her left side and it triggered a response. So she was able to get into treatment, recognize that things were swelling and was able to get it under control. But it's things like that, or if you have a fall and you land on the affected side, these are all things that could be problematic in the future. So just being mindful and taking care of your body. The other thing too is avoiding anything that constricts, like something too tight of a watch, too tight of rings, tight jewelry, or extremely tight clothing. Anything that causes like a tourniquet effect. Like if you picture a rubber band being wrapped around your finger and your finger turning blue, you don't want to constrict any of your circulation. That also applies to exposing yourself for extreme temperatures. Many people don't realize, like being in a sauna or like a hot tub for long periods of time. The guidelines actually recommend less than 15 minutes in a situation where you're in extended heat or extended cold time frame. I know a lot of people are doing more cold plunging these days, so the same applies to that. So the benefits of strength training, there was a study conducted at the University of Pennsylvania back in 2010, and it emphasized the importance of strengthening after breast cancer. So what their findings actually indicated in a guided strength training program that 50% were reduced likelihood of lymphedema worsening through strength training. And then 70% reduced the likelihood of an onset with women who had 5 or less lymph nodes removed. It also found that it improved strength and energy, improved body image, reduced body fat, and prevented decline in physical function over time. So I always emphasize when you're starting a strength training program, especially after having breast cancer and having breast cancer related treatments, you really want to have guidance from a professional so that way they're giving you feedback on the intensity of what you're doing and guiding you through body mechanics, making sure that you're doing things that's not causing additional injury. And you're being monitored. So if you start exercising and you notice that you're getting some flare-up symptoms of your swelling, maybe that's a time now you wear a compression sleeve. And you shouldn't have to make those decisions alone. You really want to make sure you have the support of someone that is experienced in this area to say, you know what, maybe we need to implement this, maybe we need to dial back. And that way you're getting feedback related to your condition. So this is a couple pictures of how to inspect your arms, your hands, and then after this, we'll go over how to do some lymphatic drainage. So when you're looking at your hands, you can put your hands right up against a blank wall, or this in this case is my shower curtain. You're just going to put your hands straight out in front of them and look at them together. And what you're looking for is you want to see the tendons of the hands. So, and you want to look at them in comparison. The spaces in between the tendons, are they filling? Or can you see your tendons really well? Other things, if you're looking at your knuckles as you make a fist, it should have peaks and valleys. So are those valleys filling, right? Is there fluid that's coming right in the area right through here? So where there should be a little gap if you were to draw a line and you could see light through it. So you look at them in comparison to one another. Other areas, you want to see some creasing in your wrist when you extend your wrist. And then the other part too would be the width of the forearms. So when you're looking at the width of your forearms with your arms extended out in front of you, are they about the same size? And remember that pitting technique that we talked about where you push gently using your finger, and if it holds for about 2 to 3 seconds, that could be your sign that there's swelling present in either the hand, the forearm, or upper arm. And then also looking at the front of your hands. So looking for creases and seeing whether or not you have similarities among the two sides. Now, this is me in front, picture yourself in front of a mirror, right? So you're stacking your forearms so that way you're looking to see the width as you're looking straight up and down. And are they about the same size, or is one larger than the other? Are you seeing the proper shadowing of your muscles, right? Where there's spaces in between the two bones of the forearm. You want to make sure that that looks similar. And then in the next picture, you're looking for the width when you're pointing your elbows towards your mirror. So you're looking at the width of your elbows from comparative sides. And same thing, everybody's favorite spot to look at on their arms, right? Any draping underneath the arms, you're looking to see that they match, right? That there's not one that seems or appears a little bit larger than the other. And same thing along the biceps. So without flexing and making a muscle, but keeping your arms out to the side, you want to make sure there's no additional draping. Now, what's challenging in situations are my patients that have had a double mastectomy and lymph nodes taken on both sides, because in essence, you're actually at risk and you really can't use the one arm to compare to the other. So in that case, you really have to base on your symptoms, what the appearance is, and how you're feeling. So that's something that is a little bit more challenge for my patients that have more involved surgical, and radiation journey related to their cancer. So I'm going to kind of back out of this for a second because we're going to watch a video on how to do basic manual lymphatic drainage. In this case, it would be for the left breast, but you can also switch sides based on the techniques that you'll see. So I'm going to go over some directional pathways and we'll discuss the concept of skin stretching and how to do that. So when you do manual lymphatic drainage, it's important to stimulate areas that have lymph nodes around that are not congested. So in this case, I'm stimulating the lymph nodes right around my neck. And you want to do it in a sequence of about, I'd say 7 to 10 strokes. I've shortened it for the video purposes, so I'm doing about 5 as opposed to 7 to 10. But if you have targeted areas that are a little bit more sensitive or a little bit more full, then you could do additional amounts of skin stretching. I did the collarbone right above the collarbone, and now I'm taking some nice big diaphragmatic breaths where I'm stimulating the lymph nodes around my abdomen and trunk. So after doing that, then you would start stimulating the lymph nodes of both underarms. So you're going to go strokes that are circular strokes towards the back and then pulling inward towards your armpit area. You would do under both sides. Because there's zones where you actually have drains. This is stimulating the same side that you would have your breast cancer. So in this case, it's the left. You would also stimulate the groin lymph nodes. And then you're trying to push fluid away. So if it's my left breast that's swollen, I'm trying to push fluid away towards my right armpit in this. So you don't want to use lotions. You want to make sure that you actually get the friction and connection from your whole hand and you're sweeping across. It doesn't matter which hand you use, it just has to be in the proper direction. You can alternate hands and you emphasize the importance of starting at the midpoint. So there I started by my ribs. I didn't go directly to the armpit or arm area or breast area. You kind of have to clear that pathway before you go directly to where you're swollen. So you touch all these parts ahead of time before you actually get to the swollen part of your body. And after you open up some of those pathways, then you can spend a little bit more time in the areas that are swollen. So now I'm reworking the area in the pathway above that connects both armpits. And ideally, you want to do this not wearing your clothes. So I'll tell my patients, if you can sneak in manual lymphatic drainage about twice a day, picture the time frames that you're going to get dressed. So you want good skin connection between your hand and the skin that you're targeting. And ideally, you don't want to have any clothes on. So that way you get the proper skin stretch. And then reworking the opposite area. And afterwards, after you do about 7 to 10 strokes at each side in each direction, then you would rework and stimulate the lymph nodes of the parts of the body just as a clearing towards the end. So I did both underarms, my left groin, and then I'll finish up around the neck and collarbone area, as well as doing some deep breathing. And I don't expect anybody after watching the video to feel like they have a great understanding of how to do this. That's the whole reason why coming into therapy is so beneficial. We can go over different techniques that make it easier for you to do at home. And we can shorten it. It doesn't have to be. It's better to do even if you start with just deep breathing. It's better than nothing. Close that. Okay. We'll go back to my slides. Okay. So closing remarks and questions, what I would really emphasize is discussing your care plan with your medical team and consider if therapy is right for you at this time in your survivorship. You want to consider your risk factors because this is going to guide your decision as to when to get evaluated. If you're newly diagnosed with breast cancer and you have a lot of questions and you're getting ready to prepare for surgery, then you may want to come in prior to your surgery or shortly after your surgery when your doctor clears you. Ideally, it would be great to have all of our patients come in pre-surgically and then pre-radiation. That's when we can establish those baseline measurements when there's usually no signs and symptoms of lymphedema. You really want to keep your team informed about your body changes or any concerns you have at any point. And then a referral to therapy early in your recovery may reduce your risk for certain complications or for lymphedema. So, what I want to emphasize in ending our presentation today is really maintaining a healthy lifestyle and caring for your skin, knowing the signs and symptoms and how to look for them and also how to respond. So, I hope that this has been really helpful for you, and I'm happy to entertain any questions that you have. Um, as far as coming to clinic, this is once again, our therapists in the area that treat lymphedema and are your specialists for oncology rehabilitation. We look forward to meeting you at an initial evaluation. And at any point, please feel free. I'll make sure I provide Kate with my email. And if you have any additional questions and just want to contact me, I'm happy to answer them. Does anybody have any specific questions
And
after?
also, if anyone is watching on Facebook Live, you can type your questions in the comments and I can read them out here.
Okay.
Okay, I don't see anything on Facebook, so I'm going to end the live stream.
Okay.
So for everyone here on Zoom, you can have a little more privacy in asking your questions.